Good evening. This is my applied reflection for our text readings, chapters 1, 2, and 13. Um, Chapter 1 focuses on the what quality management is and allowing the reader to understand what quality management is, the levels of quality management, and how they are applied within the healthcare setting, such as quality assurance. That's more on the mechanical side of things. It focuses on the mechanics of the services provided, such as blood pressure machines, IV pumps, lab equipment, such as autoclaves. It also focuses on um, quality um, assurance. That is the focus on the outcome of a process, such as a patient goes in for knee replacement, and when they come out of surgery, everything went the way it was supposed to. Patient is up and walking within X amount of hours. They are automatically starting within physical therapy. There's no glitches, there's no quote unquote hiccups within this process. This is quality assurance. And then you have quality improvement, also considered continuous quality improvement. Basically, what this means is it's a focus on quality improvement at the entire level. And it is a process to where you're constantly and continually improving on each process and how to make it better to ensure that you're providing the best quality of care for your patients. Um, Quality improvement is affected and affects three different people or groups of people within a facility. Those are your external customers, such as your patients, your internal customers, such as physician to physician, and then your uh, stakeholders. Sorry. Your stakeholders. Those are the people that are invested into your healthcare facility, whether it's donors, insurers, Medicare, Medicaid, private insurance, any third party that is invested in your healthcare facility that is affected by the overall outcome or the um, bottom dollar. Chapter 2 focuses on licensure, or excuse me, it focuses on quality management that is affected by outside sources, such as licensing, accreditation for your providers, public and private policy, such as quality initiatives by the CMS or Centers for Medicaid and Medicare Services, um, quality improvement that is uh, measures that have been set aside by the ADA or the American Disabilities Act of the 1970s, which ensure that your facilities have handrails, um, sprinkler systems, etc. Basically, what it does is it breaks it down and allows the reader to understand just how outside sources can greatly affect your quality management measures within a healthcare facility. It is those measures, your quality measures, do not just originate from inside the facility, but they are also outside factors such as Medicare, Medicaid, private insurances, laws, healthcare policies that are put in place, such as the Affordable Care Act. These are all things that are going to affect your quality improvement and your quality improvement measures that have to be initiated within your facility. And then finally, chapter 3 focuses on patient safety. You cannot have patient safety without have quality um, management. You just can't. Um, when you are in a healthcare facility and you're walking by a room and you see this little falling star outside of a patient's door, that means they're a fall hazard. Guess what? That's a quality measure that has been initiated within the facility to identify that patient as a potential fall patient, and meaning that we need to be more aware that this patient needs um, things utilized or put into place to ensure that they don't fall, such as non-slip socks, um, making sure that their call bell is close to them so that way if they need to utilize the restroom facilities, they can get a nurse or nurse's aide in there to help them get to the restroom so that they won't fall. Um, if you were in a healthcare facility and your neighbor is bedridden, they can't get out of the bed, and you see the nurses come in every 30, 45 minutes, an hour, whatever hospital policy is for that particular facility, and they're rolling the patient over and they're moving them and they're putting pillows in places. This is to ensure that they're not getting skin breakdown because maybe they can't utilize restroom facilities and they may soil themselves. They're bedridden, can't get up, and walk up and down the hall and push their IV pump outside to have a cigarette. Um, Seen it, it happens. But these are quality these are quality measures. These are quality measures that are put in place to ensure patient safety. This is what Chapter 13 focuses on. It simply states that quality improvement, unfortunately, there's no clear cut identifiers. There's no clear cut, this is going to result in this is going to result in that. We just know that if we can do this, then this is the probable outcome, and that's what we're going to do. If it doesn't work, we're going to take it back to the line and we're going to punt again and we're going to try something different. Um, we just have to realize and we have to remember that quality improvement, quality management, patient safety, this is a continual process without the entire organization. One person, one group, one floor um, is not solely responsible, but it is a group and a organizational effort across the board to ensure that we are providing the best quality care and the best patient care for our patients within our facilities.